What is the quantified self?
The quantified self, quantified to measure, to gain insight. It started out as a consumer movement only about 5 or 6 years ago. There's now chapters all around the world. I'm wearing actually 6 different versions of quantified self wristbands, but they all kind of do the same thing. They can measure steps and sleep, but we're moving from these sensors 1.0 to more integrated sensors. Some are embedded in our phones, some are being embedded on smart patches that you can basically give intensive unit ICU level care. I'm wearing a patch underneath my shirt that's streaming my vital signs to the cloud. And I like to say it's moving from quantified self to quantified health. These start as, non-FDA approved consumer devices, but we're not too far from me prescribing you a device that helps track your activity if you're a patient who needs to get up after a surgery, for example, or I want to encourage your cardiac activity and I can prescribe you exercise. So when we're moving this world of connected blood pressure cuffs, which we have, and glucometers, which are already FDA approved and on the market, to a world where quantified health will become the norm and the feedback loops will be integrated. I mentioned in my talk today this idea of a medical tricorder. This is a company called Scanadu that's making essentially a medical tricorder. I can hold it to my forehead and it picks up my heart rate, my blood pressure, my temperature, my oxygen saturation, records that on my phone, communicates that to my clinical team. And I think as we see the more integration of the data, the sensors, quantified health is going to become the norm. And these feedback loops, which have been until now kind of broken or non-existent, will really help speed up both health and wellness, diagnosis, and therapy.